Thank you all for joining us. It's very exciting to be here today, and we wanted to welcome you all to the UN Foundation and to our many participants from around the world. Welcome to our webinar. So my name is Beth Schlachter, and I'm the director of FP2020. This is our fourth stakeholder consultation, and we're very excited by the enormous response, positive response we've had to this consultation. We have over 300 people joining us from countries around the world, and we have 2 sites, including here in Washington, D.C., and we also have guests at UNFPA's office in New York. So welcome to everybody through the various means that you're all participating with us here today. So before we begin, we have a few housekeeping rules, and I'll just explain the flow of our morning because we have quite a complicated agenda with many moving parts. So we'll ask that you bear with us as we invite different guests up to the front seats and move people in and out, and then go to a couple of different locations. We also have many guests who've joined us today who are French-speaking, so we have translation available for English or French, depending on what you need. So if you don't have headsets and you need them here in Washington, please do go back up to our reception and for those if you need them. And for those who are joining via our webinar, we have what we hope is a very dynamic platform available for you today. You'll see 2 screens. One is a live feed of us here today, and the second screen, or the second half of this screen, is the PowerPoint on the various presentations that you'll have. You can also see we have a Q&A opportunity for you, several modules. You can either do it through our Twitter feed or through a Q&A module that's on your screen. There's also, in case the platform is a little tricky to use, you can request our assistance 2 different ways, either through the Q&A module or you can submit a question to us through the platform and through our email address. There's also a video guideline, and if you still need that, where you can go and see a video itself, which will walk you through the module, and you can find that at our website, Planning 2020 /stakeholder consultation. And on that platform as well, you can see the various documents that we've prepared to support today's presentation, and they're available both in English and in French. Again, the entire presentation will be live streamed. It's also being recorded, so it'll be available after today's presentation for your reference as well. So we'll be fielding a number of questions. We've already received over 100 questions in advance of the consultation this morning. So later on, we'll be pulling from those questions, and then we'll be taking a few live questions depending on how much time we have available to us. You can submit your questions now or throughout the consultation via Twitter at #AskFP2020. So with that, we'll move to our agenda. As I mentioned, we have what we hope is quite a dynamic and interesting agenda for all of you here today. We'll begin with our most exciting news, which will be our new commitment makers. We've also asked one of our key partners, USAID, to sort of kick us off as well. As you know, family planning commitments are both transformational at a national level and crucial for our combined global effort to reach 120 million additional women and girls with access to family planning by the year 2020. Our ultimate goal is to ensure that we have healthier women, families, and communities around the world, and that we empower women and girls to make essential choices about their own lives for themselves. This is truly a remarkable moment to welcome new commitment makers to our partnership, and we're so pleased to be able to share this with all of you here today. After we do our commitments, then we'll move to New York to hear from UNFPA's Executive Director, Dr. Babatunde Oshotemeng, and we'll follow that by a brief overview of our second annual progress report, Partnership in Progress. After that, we'll hear from Pfizer with interesting news about expanded contraceptive options for women and girls around the world. And then we'll hear from our Rights and Empowerment Working Group about their new principles for family planning. And we'll wrap up with a Q&A session. Again, you can participate in that through the various means that I've already explained. And we do encourage everybody to submit their questions as you get a chance. So without further ado, we'll launch into the meeting itself. We're honored to have Ellen Starbird join us today. Ellen is Director of the Office of Population and Reproductive Health at USAID. She's also one of our co-leads for FP2020's Country Engagement Working Group. As many of you know very well, USAID has been one of the world's leading champions of family planning for almost 50 years. We're very proud that UNFPA is such a staunch supporter of FP2020 and one of our core conveners. So with that, please join me in welcoming Ellen Starbird.
Thanks, Beth. Good morning, everyone. On behalf of USAID and the FP2020 Country Engagement Working Group, welcome to this FP2020 Stakeholder Consultation. And thank you for being part of this global movement. Each of you in this room, on the phone, or using video technology, and many who aren't able to join this particular meeting today, is important in making FP2020 a success. International family planning is an impressive story of global evolution in social norms and behavior change. Modern prevalence has more than quadrupled since 1960, and actual family size has declined from over 6 children per woman to 3 on average. Change that took 4 and 5 generations in Western Europe and the United States has transpired in just 1 or 2 generations in Asia and Latin America, and is unfolding increasingly rapidly in much of Africa. For 5 decades, USAID has played an intellectual and technical leadership role in this transformation, in partnership with NGOs, civil society, country advocates, government leaders, and strong women and men the world over, and now in partnership with FP2020. We welcome 3 new countries to the FP2020 family today: Togo, Cameroon, and Burundi, and I think we should give them a hand. You join 27 other nations whose highest political leaders have also committed to address the policy, financing, service delivery, and sociocultural barriers to access to contraceptive information services and supplies. I had the pleasure of having dinner last night with the representatives from Togo and Burundi who are here today with us today, and I asked Dr. Juma from Burundi why his country wanted to join FP2020. He replied that Burundi wanted to be part of a global movement, to learn from other countries, and to accelerate progress. And I think this is the essence of FP2020. Family planning receded somewhat from the global radar screen in the years following the 1994 Cairo Conference on Population and Development, as the broader concept of reproductive health took center stage and attention and resources shifted to fighting HIV/AIDS. The 2012 London Summit on Family Planning and FP2020 have brought welcome global visibility back to family planning as a key component of this broader reproductive health agenda. As a global movement, we can and must keep family planning on the radar screen as a not yet reached Millennium Development Goal, as a core element of the R in the RMNCAH focus of the newly forming Global Financing Facility, and with rights and empowerment as a non-negotiable component of the post-2015 Sustainable Development Goals. What happens on these issues for FP2020 will in part determine how big the lift is to get to 2030. But we must act as a movement, together, strategically, and supportively. Acting together also means sharing knowledge and experience and learning from one another, another bit of the essence of FP2020. At USAID, we believe that scaling up proven best practices is one of the fastest ways we can accelerate progress. Every one of the FP2020 working groups has a work stream or a set of activities that is about synthesizing and sharing knowledge and best practices. This stakeholder consultation is one forum for that, and as Beth noted, there'll be some Q&A later in the session to address some of the questions you have submitted. The FP2020 website is positioning itself as an interactive knowledge-sharing platform, joining other web-based knowledge-sharing sites like K4Health.org, the Family Planning High Impact Practices website, and the IBP Knowledge Gateway, to name a few. FP2020 also seeks to promote South-to-South knowledge exchange. We've put countries that are considering pledging to FP2020 in touch with countries that have already done so. The Ouagadougou Partnership Countries, a regional partnership of the French government, USAID, and the Hewlett and Bill and Melinda Gates Foundations, and 9 Francophone West African countries, comprise a subset of FP 2020 countries. It's also a partnership that predates FP 2020. It's holding its annual meeting in Paris next week to share progress and plan for the future. And FP 2020 will hold its first FP 2020 focal point meeting in late February, bringing together donor and government focal points from the 30 pledging countries to solidify understanding of FP 2020, share experiences, and accelerate progress. Accelerating progress is that third bit of FP 2020's essence, and that must happen first and foremost at the country level. Youth are a particularly important population to reach. Young people aged 10 to 24 comprise more than 30% of the population in many developing countries, and their reproductive health knowledge and access to information and services is generally worse than that of married women of reproductive age. Their access to education, health services, and jobs, and the decisions they make in these areas will affect the world's progress for decades to come. It's impossible to think about future FPRH programming without considering the needs of youth. However, they're not a homogeneous population, and nor are they the only key population. Postpartum mothers and post-abortion clients are key audiences for messages about healthy birth spacing. Rural and peri-urban populations often have to travel long distances to access services or find them too expensive. Reaching these underserved populations with information, services, and products that meet their varied family planning and reproductive health needs will accelerate progress. Costed implementation plans are a path to accelerated progress at the country level. USAID and others have helped support the development of many of these plans. Costed implementation plans for family planning are concrete, specific plans for achieving the goals of a national family planning program over a set number of years. They may be standalone plans or part of more comprehensive RMNCH plans. They provide direction and focus and can help ensure that evidence-based strategies and programs that improve family planning access are prioritized and funded. They also underscore FP 2020's strong emphasis on country ownership. They provide a clear basis for requesting resources from domestic and donor sources and a framework for aligning and rationalizing donor support. The exercise of developing the plan is also an opportunity to engage civil society in defining needs and solutions, and to ensure that family planning programs are built on a rights-based foundation. While FP 2020 has a numerical goal so that we can track progress, this effort is not about reaching a number, but about reaching people, particularly the underserved, who do not have equitable access to the family planning and reproductive health services they want and deserve. Adolescent girls who want to avoid pregnancy so they can stay in school, couples who want to stop having children when they've reached their desired family size so they can provide the best for their family, and women and men who recognize that their children will be healthier if they can space the next pregnancy at least 2 years after the previous birth. We have much to do, from the smallest advocacy organization or NGO to the largest stakeholder, whether civil society, government, international donor or foundation, service provider, or client, to ensure that this movement accelerates progress and becomes a mainstream reality, not to be lost again in the press of other business. FP 2020 needs and looks forward to your continued engagement. It's now my great pleasure and honor to introduce a friend and valued colleague, Purnima Mane. She's a familiar face to many in this field. For more than 30 years, she has championed the advancement of women's health and rights, from positions as Assistant Secretary General of the UN and Deputy Executive Director of UNFPA to currently as President and CEO of Pathfinder International. At Pathfinder, she oversees more than 1,000 staff around the world and sexual and reproductive health programs in more than 20 developing countries. Please join me in welcoming Purnima Mane.
Thank you very much, Ellen, for that kind introduction. And good morning to everybody. Let me start first by thanking Beth and my friends and colleagues at FP 2020 for inviting me to be a part of the stakeholder meeting this morning. I've been introduced so kindly by Ellen, I had not expected that, so I plan to say a little bit about myself, so I won't. At the London Summit in 2012, I shared Pathfinder's commitment to increase financial support for family planning programs in our existing program countries and at least 2 new countries. We also set a goal to raise an additional $3 million by 2014 to augment our already robust family planning related programs, with 1/3 of this commitment dedicated to reaching young people in underserved regions such as West Africa. And at that time, as you can imagine, we had a lot of discussions in-house what we were going to do in order to get to this commitment. And of course, I was terrified. I'm pleased and delighted to share that we exceeded our goal to raise $3 million to augment our family planning programs. And in fact, financial support for family planning programs in our existing program countries increased by $11.5 million. And we successfully secured funding to launch family planning programs in 2 additional countries, Bangladesh and Haiti, thanks to USAID. With an initial investment of $1.2 million, we created a program focused on the family planning needs of young married couples in Francophone West Africa. And our success there has led to directly funded activities through local partners in Guinea and Burkina Faso, and an $8 million project by the Bill and Melinda Gates Foundation in Niger, which are focused on delivering family planning services to remotely located populations. At Pathfinder, we are grateful and truly appreciate all of our donors and funders that make our work possible, including family foundations and individual donors. And I'm going to mention just one who's seated right here representing the Brush Foundation. The Brush Foundation committed $30,000 towards global family planning efforts in 2014, a significant portion of which is being used by Pathfinder to advocate for the removal of policy and regulatory barriers which limit access to family planning in certain places. Our partnership and collaboration with the governments and the civil society organizations in the countries in which we work are paramount to what we do and to our success, as well as the future that I think we all envision. Our relationship with the government of Burundi is special and very dear to us. And their announcement today is something that we truly welcome and endorse, and it's the result of a lot of shared commitment and cooperation with the government of Burundi. It's my great pleasure to introduce my esteemed colleague from Burundi, Dr. Chloé Ndayikunda. She is Assistant to the Ministry of Public Health and the Fight Against AIDS, and she will be officially announcing Burundi's FP 2020 commitment. So over to Dr. Chloé. Thank you.
Director of FP 2020, Executive Director of UNFPA, Director of the Office of Population of USAID, also the Director of Health for Family and the Minister of Public Health in Cameroon, Secretary General of the Republic of Togo, distinguished guests, ladies and gentlemen, dear partners and colleagues who follow us from the 4 corners of the world, all protocol observed. Hello. In the name of Her Excellence, Mr. Minister of Public Health and Fight Against AIDS, and in my own name, I would first of all like to thank the organizers of this endeavor who thought to associate Burundi to this historical event of such high importance for the health of the mothers and the children. Our thanks are also geared to the government and the American people for their heartfelt welcome. We benefit of that in this wonderful country, but also we thank them for everything they did so that we could obtain our visas. Excellencies, ladies and gentlemen, distinguished guests, the government of the Republic of Burundi supports the initiative FP2020 because it is part of the framework to operationalize a series of political and strategic orientations on a world level and on a regional level, trying and having as a goal to improve the health of mothers and children, such as the global strategy of health of the woman and the child of the General Secretary of the United Nations, the action program ICPD post-2014 campaign for acceleration of reduction of maternal mortality in Africa, and also other regional and local initiatives targeting to reduce sensibly the maternal mortality and infant mortality on the African continent. Well, the reduction of this mortality is only possible if young girls and women have access to information and to services of sexual health and reproductive health, which are of good quality. Allowing an additional access to contraceptives to 120 million of women. The FP 2020 is going to try to respond to this need, and this is why Burundi is so interested to attach so much importance to this initiative. Excellencies, ladies and gentlemen, distinguished invitees, for Burundi the investment in family planning is important, and more than on one level. In fact, with a maternal mortality rate of 500 deaths per 100,000 live births, the mortality infant juvenile of 96 deaths for 1,000 live births, a mortality of infants of 59 deaths for 1,000 live births, according to EDS 2010, Burundi exceeds a set record for maternal and infant mortality. And this mortality, it costs a lot of money, and a lot of strength of individuals, households, communities, and the state, and compromises all the efforts trying to relaunch economic growth. The government of Burundi is ready to work with all of the other partners who have the same objective, to reduce maternal mortality and infant mortality. And this is why we seize this opportunity to congratulate and to encourage the organizers of this event, which will allow us to enter into contact with other people who are motivated to fight for the same cause. Other than the reduction of maternal and infantile mortality, Burundi is also confronted to the enormous problem of population. In fact, with a medium density estimated today to 325 inhabitants per kilometer square, Burundi is one of the countries which is the most densely populated in sub-Saharan Africa. The demographic pressure on the environment and the feeble resources which are at the avail of this country start to weigh very heavily on this country, and if nothing is done very soon, then the situation is doing nothing but getting worse. Two examples, among others, will suffice to illustrate my comments. The effects of the high fertility rate, so synthetic index is 6.4 children by woman, and the demographic growth, which is enormous, where 90% of the population lives of agriculture and of cattle raising. So this is triggering enormous land conflicts. More than 70% of court cases have a direct link with land conflicts. Also, in Burundi, you have a chronic, very high malnutrition rate, with more than 58% of children under 5 years old who suffer from chronic malnutrition, according to the EDS 2010. This is why the government of Burundi wishes to reduce maternal and infant deaths and to improve the population from Burundi, and they have rejoined the other partners to adhere the initiative FP2020. The goals of the engagement of Burundi are labeled as follows.
Reposition family planning with the general objective of promoting sustainable development and to consider adequate growth of the population and the availability of resources for survival in Burundi. Arrive at prevalent contraceptives, prevalence of 40% by 2015, which would represent an increase of 18 points from 2010, and arrive at a contraceptive prevalence of 50% by 2020. Investment in complete sexual education for the youth, as well as at the schools at early level and secondary level. Increase the number of people accepting modern contraceptive methods from 322,314 in 2012 to 644,628 in 2015. Assure equitable access to all women to contraceptive methods of their choice and of top quality. These objectives have been translated in 14 commitments, of which 4 of a political character, 3 of a financial character, and 7 that are connected to the offer and programming of services. The realization of these commitments will be followed by a technical work group, including the Minister of Public Health and Fight Against AIDS, UNFPA, World Health Organization, USAID, and the Netherlands. This committee will be able to join other local experts susceptible to help in this work. The committee will have as a role to mobilize the resources necessary to reach these commitments, to execute the budgets and follow them, to offer reports on the state of progress of each activity and orient all concerned players in the realization of the intervention. An action plan for these commitments will be pulled from this National Strategic Plan for the Health of Reproduction and will be elaborated at the beginning of each year. For 2015, the plan has been elaborated, and we have already received a commitment to cover these. Before finishing, I would like to reiterate my thanks to the government and to the American people for their warmth and all the marks of attention of which we have received on your part. We would like to integrate the services as well in our program to augment, increase community services, and that will provide all needs for family planning, including promoting the health of women and to have all health workers involved in different methods of contraception. We want to improve the availability and the delivery of such modes of contraception, of choices, and permanent methods as well. We would like to create a demand to meet the needs of the population for family planning, and particularly improve the access of the training for workers within family planning, especially targeted towards young people via communications, modern technology of communication, so that there can be a complete sexual education in the schools at all levels. We would like to reinforce the financing at the community level, thanks to the support of partners. This will be followed by a technical work group, including the Minister of Health, also again the UNFPA, the World Health Organization, USAID. This committee will be able to join other local experts that will be able to assist in its work. The committee will have as a role to mobilize resources necessary to meet these commitments, to follow that the budgets are well executed and adhered to, and to report on any progress of activities, and offer orientation to all people involved in the realization of this intervention. For the year 2015, the plan has been elaborated. It will be $4,500,000 American dollars, of which $1,565,000 we have already received commitments from our local partners. These estimates did not include all that we have received from various NGOs. We have not been able to receive financial information from each of our NGO partners. And again, before leaving you, I would like to once again thank the American government and people for your warm welcome and for all you have done to assist us and for organizing this event, which will allow us the opportunity to participate in this historic event. I wish much success to all the discussions that will follow and all the work that will follow to help us share our experiences one with the other in the domain of family planning, together to save mothers and children. I thank you. Bonjour à tous et merci beaucoup. Je m'appelle Julie McPherson. C'est mon plaisir.
Cameroon. Chai works very closely with the government of Cameroon, and particularly with the two individuals here today. We can attest to the incredible political will and motivation that they have to move family planning forward in the country. In just over the past year, Cameroon has made unbelievable progress. They have secured a budget line for contraceptives. They have reduced the prices for family planning products and services to clients. They have increased procurement volumes and assumed full responsibility for for storage and distribution. They have worked with partners to train hundreds of providers in family planning and particularly long-acting methods. And they have just developed a costed operational plan for family planning. And it is that plan from which the commitments announced today are born. And I think that's particularly important and evidence of the commitment and the real national priorities that have been set forth. So with this declaration and with this plan, Cameroon really joins the global efforts to put an additional 120 million women and girls within access of family planning. And if they achieve their targets, 1 million of those will be Cameroonian women. So this is extremely exciting. And with that, I have the pleasure of introducing Professor Robinson Mbu, who is the Director of Family Health at the Ministry of Public Health in Cameroon, and truly the force behind a lot of the progress that we've seen and putting family planning back on the agenda. Prior to this, he headed the largest maternity hospital and has decades of experience as both a provider and a leader in the field. He is joined today by Dr. Kuangambi, who is the family planning focal person and the head of maternal health services. So without further ado, please join me in welcoming the Cameroon delegation and Professor Mbu.
Good morning. It is my honor to be here today and to present the Family Planning 2020 commitments on behalf of the government of Cameroon. Cameroon has one of the highest rates of maternal mortality, all of you know about that, and a fertility rate that has remained stagnant but high in the last 15 years. Each woman in Cameroon has an average of 5.1 children, with a low rate of contraceptive prevalence of 16.1% of all women of reproductive age, especially in the rural areas and among the youth, and a high rate of unmet needs of about 17%. So the government of Cameroon has repositioned family planning as a priority strategy to bend the curves of maternal mortality in the country. The indicators that I've just mentioned vary in the different regions of the country. The government of Cameroon is committed to reaching ambitious targets in family planning, especially increasing the contraceptive prevalence rate from 16.1% to about 30% of all women of reproductive age by the year 2020, and reducing unmet needs from 17% to about 10% by 2020. These are the targets that have been set in our reproductive, maternal, neonatal, and infant health strategic plan of 2014-2020. This will mean that almost 1 million more women and girls have access to family planning methods of their choices in Cameroon by 2020. As access to services increase, we will ensure that all women of reproductive age have access to quality family planning services that respect their choices. The government of Cameroon is financially engaged in ensuring the accessibility of contraceptive and family planning services to the population. In 2012, we instituted a budget line for the purchase of contraceptives in the national budget. We aim to increase this budget line by at least 5% each year, dedicated to the procurement of contraceptive, and will ensure that the budget line is put in use each year. To improve our geographic and financial access to family planning services, the Minister of Public Health will design a system to subsidize family planning services for the target population, especially adolescents, youth, and vulnerable women. The Department of Family Health, which I head, will advocate for the government to increase financial support to reproductive health by 5% per year, including the amount dedicated for family planning. In addition, we will also look onto non-traditional private sector and civil society organizations to support family planning. The Minister of Public Health will take innovative new approaches to increase the availability and accessibility of family planning services, including community-based distribution of short-acting methods by community healthcare workers, to more effectively reach out to women in rural areas. We will ensure that facilities offer the full range of quality modern family planning services, including counseling, that providers are trained in family planning and subsequently receive supportive supervision. After many years plagued by constant stock outs of family planning commodities, Cameroon now has sufficient supply of stock to meet the needs of its population. We will continue to ensure that all methods of contraceptives are available in sufficient supply to meet the needs of the population and eliminate stock outs at the central, regional, and particularly the facility levels. As the leader of family planning in Cameroon, the Ministry of Public Health will collaborate with other ministries to enhance a multi-sectoral approach to improving family planning services throughout the country. Under the leadership of the Minister of Public Health, there is a strong platform of coordination and collaboration at the central level between the Ministries of Public Health, financial and technical partners, and civil society organizations. This coordination has been essential to the development of our Family Planning Operational Plan 2015-2020, which clearly outlines the priorities of family planning over the next 5 years. The Contraceptive Security Plan also has been developed for 2014-2020 and harmonization and revision of prices for contraceptive and family planning services. We will continue with this important coordination at the central level as well as improve on the regional level coordination of family planning activities among ministries and partners. Family planning is a priority strategy for Cameroon in the reduction of maternal mortality, beginning with a campaign for the reduction of maternal mortality and the reposition of family planning. We see this as an opportunity to declare our commitment to family planning in Cameroon, share experiences with other countries and partners, and advocate for financial and technical support for our family planning program. We are pleased to be here today representing the government of Cameroon and to present our Family Planning 2020 Declaration. Thank you very much.
Good morning. My name is Sarah Clark, and I represent the Futures Group, where we deliver innovative, locally relevant, evidence-based solutions for health and well-being of people worldwide. Thanks to USAID, we implement the Health Policy Project, which carries out programs in 30 countries as well as provides global leadership and knowledge on the knowledge base for policy, advocacy, governance, and finance. In family planning, of course, but it's in other health programs as well. We're pleased to be an early partner in the Ouagadougou initiative, that Ellen mentioned earlier, which is one of the predecessors and came up with the model, I think, that was eventually adopted in this much grander coalition. And we're also very happy to be one of the implementers in developing and carrying out the costed implementation plans that provide so much of the basis of the work that is discussed here. But in addition to all that, it's really a personal pleasure for me to be here because I did spend 4 years in Togo as the representative of USAID there. We've also been very interested in working with and following the implementation plan for the repositioning strategy. So I'm delighted to be able to introduce Professor Gado Agarassi Napo-Koura. Professor Napo-Koura currently serves as the Secretary General in the Ministry of Health in the government of Togo. He's a physician and a biologist with distinguished record of government and international service. He was the head of the pathology lab in major hospitals both in Togo and abroad. And he's consulted with JPIGO, the Global Fund, and the West African Health Organization. I'd like now to turn the podium over to Professor Napo-Koura to hear the latest developments in the commitments and in the field of family planning in Togo. Professor?
Merci beaucoup, Sarah.
Thank you very much, Sarah. Dear partners, distinguished guests, ladies and gentlemen, in the name of Togo, my country, I have the pleasure and the honor to present our congratulations to FP2020 for having organized this important meeting, reunion, encounter. Togo, my country, is quite honored to be a part of this family. Thank you for the work you're doing. My country, Togo, since 2006, has repositioned itself within the domain of family planning by elaborating a plan. The most recent repositioning plan for family planning was launched May 13, 2014. This plan allows us today to make these commitments to FP 2020. But even before arriving to these commitments, I would like to very quickly give you a brief overview of the situation of Togo. It's a small country in West Africa, oftentimes overlooked when we look at a map of Africa from far away. but it's a country that is very committed to the cause of women and children. So it's the borders, Burkina Faso on north, Benin on the west, and then the Atlantic Ocean on the south. The main characteristics: population of 6 million inhabitants, with 54% women, and 60% of the population is under 40 years old. So this concerns us greatly. Certain indicators, the maternal mortality is quite high. 27 deaths for 1,000 live births, and the fecundity rate is 4.8 per woman. We would like to, and there's 17% of family planning needs that are not met. All of this has brought us to put into place family planning, new family planning. You have to note that there was also a law that was signed in 2007, and as I said earlier, in 2013, this plan was just validated. There's also the safety plan concerning reproductive health, securing safe conditions, and these plans have been elaborated with partners to be put into place. In terms of programs, Togo has developed innovative strategies for securitization of contraceptive products, but also strategies for offering services with mobile services, and especially community distribution of commodities for women's health and family planning. A technical work group was also implemented, as I just mentioned. One can also add the placement of a network with civil societies working on family planning. In terms of partnerships, Togo has as principal partners for family planning. I will mention a few. If I leave some out, please forgive me. NFPA, USAID, IPPF, PSC. We are mentioning these in terms of our commitment with FP2020. We are really looking to work with many other partners and to implement a strategic plan for family planning. So what are the commitments of Togo to reposition family planning? The principal objective is to have the prevalence rate of contraceptives from 13% in 2010 to 24%. And within this vision, our commitment is the following. It's political to disseminate the national plan throughout the country, elaborate and adopt the laws concerning family planning by December 2014. It's almost ready. Disseminate the law and applying it by June 2015 to develop contractual plans with the private sector for family planning, upscale best practices. And then there are the financial commitments. Togo is committed to support and subsidize these programs. The second financial commitment is to seek other mechanisms of financing to help support the program. Program objectives are the following. Evaluate the services offered, the distribution networks. By December 2014, we shall be able to do this. Reinforce the coordination of evaluating the access to services and services of family planning for family planning and maternal health. In terms of the reproductive and sexual health of young people, also improve on this. Improve the services, considering other offers of health services on the private and public sector, improving offers at all levels, rural as well, and hard-to-reach areas for family planning, and also optimize the logistical operational chain for contraceptive products, that they may reach all who need, and ensure that health workers are offering top-quality services, and make sure that they are well qualified in family planning. Reinforce organize services of PF to isolated and marginalized groups, and promote the planification of family planning with various tools. What are the reasons that we are belonging to this initiative? The reasons are the following. Initially, we are counting and hoping that these engagements will allow us to mobilize necessary resources to support the repositioning of family planning, and to allow universal access to women and young people and adolescents to family planning services and quality contraceptives. We would like to also benefit from the success stories of other member countries, benefit from the technical expertise of FP2020 for offering these services, to be able to reach a larger target, especially the marginalized and difficult to reach groups, the young people, zones that are difficult to reach. We would also like to benefit from the financial support of FP 2020 to implement our plan. Another reason to belong to FP 2020 is to contribute to reach the goals of FP 2020 in Togo, and to make family planning the catalyst for the realization of larger democratic goals. So, in conclusion, Togo has as an ambition to improve family planning. We would like to elaborate this with our partners, and we still need the accompaniment of financial and technical support to realize these objectives, and to improve maternal health and child health. Thank you. I would like to thank our colleague from Togo one more time, Dr. Napo-Koura. Dr. Ndayikunda, thank you very much for your commitment. Thank you.
I think throughout those meetings we've heard some really common themes, some really common threads that really animate the commitments and are at the heart of FP 2020, and were really at the base of the London Summit as well, in terms of motivating our partnership and our work together to try and really get at some essential problems. These are really, we come to the commitments and to this partnership really through the leadership of our country colleagues. think it's through their political will and their willingness to really look at the hard issues and try and address them that our partnership through FP 2020 can really help build both the local commitment and the global movement to support family planning. This is best done, as we heard, through partnerships with government, with international organizations, with local civil society, and it's through that umbrella that we can best understand the local group. There was this consistent theme throughout of wanting to really address maternal mortality and the needs of women as essential services. I think that's an important point. We also heard a lot about the needs of adolescents and youth and the link there to sustainable development and as well to the use of resources and empowering youth to sort of meet their needs as they move forward in the world. We all know that global populations are really the highest percentages are for people under the ages of 35. So if we don't meet the needs of that cohort, especially as we look towards sustainable development, then we'll have a lost opportunity here with this generation of young people. Through that, that's best done, and through the programs that our colleagues have elaborated by having high-quality programs that reach out to adolescents and youth, as well as to women across the age spectrum. That's done through, I think we heard a lot about increased method mix and high-quality services as really the core to meeting people's needs. So with that, we wanted to thank you again. So our partnership, in addition to countries, is also based on the work of donors and with civil society. And so with that, today I have the honor to introduce two additional commitment makers. The first will be introduced by Jacqui Darroch from the Guttmacher Institute, who's actually representing the Brush Foundation for us today. And after Jacqui speaks, then we'll have Pamela Barnes, the President and CEO of Engender Health. So Jacqui, please welcome.
Thank you, Beth. And hello, everybody. As Beth has said, I am representing the Brush Foundation, where I'm a member of the Board of Managers. We are dwarfed by all of the organizations here, and certainly by the other donors that are part of Family Planning 2020. But we share a commitment throughout its 86 years. This is a small family foundation that started in Cleveland in 1928, and we are very small. We have a part-time administrative person. We have, a small board, and we have very small resources. But we have very ambitious goals, and we share a vision that I think you all have. We state it as a future in which family planning worldwide is available, affordable, accessible, effective, and safe. Now, as a small foundation, it's very difficult for us to make grants in developing countries. We have U.S. roots. We do not have staff that can travel. And so, actually, Valerie DiFilippo came and spoke to our board in early 2014, I guess it was, and we were very excited about the rapid response mechanism within FP 2020. And so we are very pleased that we were able to make a commitment, a small commitment of $5,000, but we feel we are leveraging the $50 million from the Bloomberg Foundation. But the key thing for us is that this gives us a vehicle that we can help fulfill our goals of being effective and responsible and contributing to the worldwide arena of our future goals that we share. And as Purnima mentioned, we also gave a grant of $30,000 to the Pathfinder Foundation, recognizing that it's on the ground in countries that's really important. And champions are needed to bring about the policy shifts and fundamental change that is needed to achieve the goals of sexual and reproductive health and rights, as we've seen from our colleagues from these countries. So we're very pleased to have made a small contribution. It's more than 10% of our total funding. So we're small, we care, and we really appreciate having a vehicle through which we could act internationally through what the Family Planning 2020 has as a mechanism. Thank you.
Thank you, Jacqui. And thank you, Beth, for your very kind introduction. And I do want to thank you and your incredible team. The momentum, the guidance, the leadership that we see really is what these partnerships are all about. And I think what has many of us very excited about FP 2020 is it's not just about the commitments, it's about getting the work done. And you've really shown that guidance. So we're very grateful for that, Beth, to you and to your team. So I am Pam Barnes, the President and CEO of Engender Health, and I'm truly honored to be here today. At Engender Health, we are really deeply, deeply committed to ensuring that every woman can choose if and when she has children and can experience a childbirth that is safe and with dignity. To do so, we support healthcare providers, communities, and governments in over 20 countries around the world. By the way, several of them represented here today by my esteemed colleagues from Burundi and Togo. Our commitment today from Engender Health for FP 2020 focuses on 3 core pillars, which I'm really excited to share with you today. First, we've committed in partnership with donors, principally USAID, an estimated $40 million to expand access to and use of safe and voluntary family planning services in West Africa. This includes broadening voluntary, I underscore, use of contraception and increasing informed decision-making. I think it's really quite exciting to hear the theme around West Africa and the commitments to that part of the world. Second, in order to assist governments and other implementing partners to fulfill their FP 2020 commitments, Engender Health is working to expand access to the framework for voluntary family planning programs that respect, protect, and fulfill human rights. This framework was developed by Engender Health and the Futures Group with the support of the Bill and Melinda Gates Foundation. This framework and the accompanying tools, such as the User's Guide and Checkpoints for Choice, which was developed with support of the William and Flora Hewlett Foundation, will play an instrumental role in ensuring that all family planning services are grounded in human rights. Third, we have very serious business to do. And as part of our role at Engender Health, we're committed to reaching at least 500,000 women in the United States through a dynamic advocacy and communications campaign. Some of you may have seen it. It's called WTFP. I have a little prop. WTFP. Where's the family planning? That will inspire more support for women in developing countries who want but do not have access to contraception and safe childbirth. We urge everyone listening today to join us and the millions of women who are asking WTFP at where'sthefp.org or hashtag where'sthefp. Everything we do at Engender Health is grounded in our belief that all women and their partners should have access to high-quality services. That's been mentioned over and over again here today. And women must be empowered to make informed and voluntary decisions. That's why we're truly honored to join FP 2020 with our commitment, which will uphold rights and choice. We look forward to working with many of you in this room directly, but with all of you in partnership to achieve our shared goals. And thank you.
Thank you, Jacqui, and thank you, Pam. It truly is an honor to see the breadth of the partnership grow through your 2 commitments, and just to show that this really is it's a big umbrella, it's a big tent, and there's room for every organization, large and small, as we really do grow this as a global movement of commitment toward meeting the needs of women and girls. So thank you very much for both of your organizations. I know a lot of you remember the London Summit in 2012, and at that summit, 24 countries made commitments, specific commitments for family planning. Last year, in the International Conference for Family Planning in Addis Ababa, 5 additional countries joined as well, bringing the total to 29. So with our 3 new countries here today, Burundi, Togo, and Cameroon, we're now at 32 countries. So this momentum, this ongoing desire to be part of this process and the continuing commitment both of CSOs, of donors, and of countries, I think is really just so heartening for all of us as we continue to build this coalition, this global movement, and really put a spotlight on the needs of women and girls around the world. So I was told that I was remiss earlier because I didn't tell our audience here in D.C. that you can also join the process of submitting questions. All of you have a little white card with you today. So if you do have any questions that popped up during the presentations or that you have going forward, please do feel free to write down your questions and then just hold them up. We have a few people around the room who will take those questions from you, and then we'll incorporate them as we can during our Q&A session that will follow the last of the presentations. So our next speaker is the Executive Director of UNFPA. I know that many of you are very familiar with the work of the UN Population Fund. They're one of our staunchest supporters, and they're one of the core conveners of FP2020. They were instrumental in putting together the London conference as well. So we have Dr. Babatunde Oshotumane on the line, joining us from New York. Against all odds, we're actually a couple minutes early. So I'm hoping that he's actually on the line now. So he's not. Okay. Yeah. So we can, well, there's one suggestion that we go early to a question, or I'm getting a signal that I don't actually understand. So we'll go to a question, I think, is maybe one of the best ways. Okay, we had a few questions, as we mentioned earlier. Actually, we had over 100 questions that were submitted in advance. So we could maybe go to one of those. And actually, the first question was for you, Jacqui, that we wanted to put to you with your hat from Guttmacher. Yeah, we're going to switch. Because last week, Guttmacher Institute released its report, or an update of its report, Adding It Up, the costs and benefits of investing in sexual and reproductive health 2014. The report talks about sexual and reproductive health needs in developing regions. So the question that we received, which we thought would be helpful for you to respond to, is how do the numbers that you have in that report compare to the numbers that we put forward in FP 2020's annual report? So if you wouldn't mind just joining me here.
Well, thank you for that question, and I believe on the seats for people is a copy of Adding It Up 2014. Others can look at the Guttmacher.org website to find it, and there actually will be a webinar hosted by PRB at 1 o'clock today on Adding It Up. If you need information on that, you can talk to me at the break or look on the PRB website. So the question is, we've got two reports, very important reports. How are they similar? How are they different? I don't want to steal the thunder for the review of the FP 2020 progress report, but as you might know, this is focused on 69 countries, among the poorest countries in the developing regions, and the focus is totally on the needs and unmet needs for modern contraception. Adding It Up, in contrast, has a wider focus in terms of countries. We're looking at all developing countries, so we're including 80 more than the 69 in FP 2020, and we're looking more broadly across types of needs and services. So Adding It Up includes coverage of contraception and need and unmet need for modern contraception. It also, however, looks at maternal and newborn health care needs, including care for pregnant women living with HIV and treatment of the 4 major curable sexually transmitted infections. So we follow this, doing costed scenarios to make estimates of current cost and needed expenditures on these services to provide care for all women in developing countries. So we're different in terms of scope, in countries, and in services. However, we use many, in terms of the contraceptive numbers, we're using many of the same data sources. We primarily demographic and health surveys. We have some differences in our methodology so that we're not quite matched in terms of numbers. However, it's very interesting and quite gratifying to see that we estimate for the 69 countries in FP 2020 a very similar level of increase in modern contraceptive use 2012 to 2013, which is very gratifying. The other thing that I do, so both of these, they're not exactly the same, but they're quite compatible. And they totally agree in terms of the conclusions that we come up with, and that is that progress is being made. There's still a good deal of progress that needs to be made because unmet need for modern contraception remains very high, and that this is something that we can achieve. We know how to do it as a world, and we need more commitments in terms of funding, in terms of action, and certainly in terms of the vision to make changes on the ground. So I'm glad to answer any questions about the specific numbers, but I don't think this is the time or place.
Thank you, Jacqui, and thank you for jumping in on such short notice to help us. And, this question we thought would also be a good follow-on for Emily Sonneveld from Track 20, who's here with us today and, in fact, will be presenting as part of our progress report on our data. So we're jumping the gun a little bit, but we thought we'd invite Emily as well to come up and say a few words from your perspective about what the methodologies look like and where there are differences and similarities to help our audience understand the different data. Thank you.
Okay, thank you, Beth. So I think I'll just second basically what Jacqui said, which is that we really start with the same data and we enter in the process in a very similar way. We have some divergence that's very specifically related to mostly when we use country and when we use regional data. But we have, probably most importantly, ended up at the same conclusions and are very transparent with each other in terms of our process. So Jacqui and I have quite an ongoing conversation about these numbers and the different processes and the different analysis that we do to produce them. So when each of our reports are coming out, we already know that our numbers are actually pretty similar, and that we're coming to the same conclusions. And we're taking every opportunity that we can to make them the same and to have synergy wherever possible, with an idea that our scopes, as Jacqui mentioned, are different. Our countries are different. Our specific focus is different, with FP 2020 really focusing on modern contraceptive use, and Guttmacher looking at a few other components as well in their analysis that integrate into the calculations in different ways. But the effort is there, and the partnership is there to make sure that as we move forward, we do find synergy and find ways to make them even closer and closer as we move forward. Thank you.
Thank you, Emily. And with that, I've had notice that we have Dr. Babatunde Oshotimen on the line. So good morning, Dr. Babatunde. I want to welcome you to our International Stakeholder Consultation. We were surprised that we actually got to your section a little bit early, so we filled a little bit of time with one of our questions that had been pre-submitted. So with that, Dr. Babatunde, I'd like to welcome you and open the floor.
Thank you, Beth. Let me start by expressing my thanks to you and to all members of the stakeholders group for this consultation. I'm happy to have the opportunity to speak with all of you in the context of this FP 2020 stakeholders meeting. I recall that prior to the 2012 July groundbreaking meeting in London, the stakeholders consultation was one which brought all of us together and actually created a momentum towards London. And I'm glad that we're still continuing to do this, because it's not just about the resources, it's about the visibility of family planning and the passion which we all bring to it, to ensure that we don't have to do 2012 again going forward. I want to note that several entities, governments, and partners have come together again to underscore their willingness to address the needs of the 120 million women and girls, which we at 2020 identified as a target at the very beginning, and that going forward, this is just a reinforcement. Specifically, I'd like to express my sincere appreciation and gratitude to the governments of Burundi, Cameroon, and Togo, and to the Brush Foundation and Engender Health for their new commitments to FP 2020. Your tangible commitment is a clear sign that governments and other stakeholders has vision of meeting the needs of vulnerable women and girls. When we came together in 2012, was not just a dream, but a concrete objective through your expression of commitment would become a reality. And going forward, we look forward to working with you. The support that governments and partner organizations are giving to FP 2020 is indeed inspiring and reassuring, and gives me the certainty as co-chair of the FP 2020 reference group, and indeed as executive director of UNFPA, that together we're moving in the right direction. We should congratulate the FP 2020 task team for ensuring that the light and the torch keeps burning, and ourselves for continuing to speak to this issue. I was in London last week looking at the new iteration of adding it up, and it seems to me that not only is progress being made in terms of numbers, but we're also reaching out and providing better quality service in many countries. But I want to most importantly congratulate the program countries for their commitment to family planning and to ensuring that human lives are saved. But going beyond that, the realization that family planning is probably the most important human development intervention any government can make in their country. Now, looking ahead, we still have much to do. I'd like to underscore and underline two areas in particular. First, as partners in the FP 2020 enterprise, we need to rally even more support and resources for family planning. There's still a resource gap, and I believe that that's something which we must continue to do. Around the world, there are forces that are working against us, and we have to overcome that inertia. Our collective efforts in raising the profile and visibility of family planning is crucial. Our collective effort in providing resources for work on the ground in program countries is in fact important. But more important is ensuring that we deliver quality service and that there is accountability in every program country. We must work together to ensure that stakeholders become aware that family planning, and given the conversations that are going on now about the sustainable development framework that would be the next step in the world in terms of development agenda, taking over from the Millennium Development Goals, family planning must be seen not only as an investment, but as part of what a government and a people needs to do for sustainable development. The second I want to underscore, which I know that is difficult in most circumstances, but it is one thing that we have to address, is we have to focus our efforts more on adolescents and girls. We need to devise concerted strategies to ensure that we further reach out specifically to the poor, marginalized, and underserved adolescents, especially adolescent girls. When we conducted the 20 years of activity, of action with the Cairo agenda, what became evident was that the inequalities in the system actually affects girls and adolescent girls more than any other demographic. So, in a sense, we have to be sure that we provide greater investments that are channeled towards the fulfilling the rights of young people to achieve their full potential. And without further progress in this area, we might not be able to claim the success that we deserve, because when you look at the demographic profile of the countries where the needs for family planning are greatest, most of the people there are young people, and so in a sense, that's where the need is, and that's why we have to focus. Let me commit myself as an individual and UNFPA as an organization to further work in these two areas. And my plea to you is that we join forces so that we can ensure that together we can transform these ambitious goals into reality. Finally, as we approach the end of 2014 and the beginning of what is going to be a year of several important issues, 2015, I'd like to express my best wishes to you and your families for a happy 2015, and to us all as the tribe of family planning, and I think, or a family planning community, if you don't like the word tribe, a productive and rich 2015, which will bring us closer to the outcomes we're striving to achieve. In my view, and that I passionately hold to, is that the best is yet to come. I thank you very much.
For your leadership and your commitment, both with UNFPA and to the FP2020 global movement and family. So thank you for taking time this morning to join us. We really appreciate your words and your encouragement. So with that, we'll be moving into our... Thank you, Dr. Babajide. Bye-bye. We'll be moving to our presentation of FP2020's second annual progress report, and we'll be joined up here by a number of our co-presenters that we'll be moving to. They'll be coming up here shortly. So, as you know, especially if you're here in this room, one of the many documents you received is our really comprehensive second annual progress report, which we call Partnership in Progress. If you're online, you can download the report at our website, FP2020. It's been downloaded over 2,000 times already, so we're quite excited by the uptake of the report and the use and the penetration it seems to already have. So I think the overriding message that we have from this report and from our analysis is that more women and girls than ever before now have access to voluntary forms of modern contraception. As you know, that was our goal for 2020, is to reach an additional 120 million women and girls with high-quality modern forms of contraception. So the progress report demonstrates that we're making progress across the board. I won't go into as much detail on the data now because our other presenters who will be joining us up here shortly will be going into that. But the encouraging news is that, again, there's progress being made across the board. In 2013, the number of women and girls using modern contraception in the 69 FP2020 focus countries rose by 8.4 million as compared to 2012. This is a significant achievement early on, and FP2020 is on the right track and making steady progress. And although we're very proud of that and we thank you all for your partnership in achieving that, we also recognize that we must collectively accelerate our efforts if we're going to reach 120 million more women and girls by the year 2020. So in 2013, across our focus countries, the use of modern contraception by 274 million women and girls of reproductive age averted 77 million unintended pregnancies, which is 2 million more unintended pregnancies averted compared to 2012. In 2013, there were 24 million unsafe abortions averted compared to 23 million in 2012. And 125,000 maternal deaths averted compared to 120 million maternal deaths averted in 2012. So I think it's important to pause here and recognize that when we talk about numbers, when we talk about benchmarks and goals, what we're really talking about are individuals, women and girls. And these numbers here of lives saved, of unintended pregnancies averted, are really at the heart of what we're trying to accomplish. So we don't think we can say it enough, but even though we have a numeric goal, that represents individuals, and we recognize that we're trying to bring quality, choice, services, and empowerment to each one of those people. So we're very encouraged by these impact indicators, and you'll hear more about those again in a little bit from Track 20 with Emily Sonneveld. Through 2013, in terms of the financial commitment, we also have encouraging news, which is that our commitment makers provided $1.3 billion US dollars for bilateral family planning funding. That represents a 20% increase over 2012. So again, strong political will, strong financial commitment from a range of partners across the partnership. There was also $460 million committed in core funding to UNFPA, which is a 5% increase over 2012. But it's not just absolute financial amounts that's important here. It's the fact that different partners have come to our collaboration as well as part of this movement to declare that voluntary family planning is one of the best investments that a country can make in its future. So despite all the measurements and statistics, again, we want to bring our focus back to the women and girls that we all hope to serve through this global movement. So the progress we've made toward our goal is remarkable, but that progress must accelerate again in the next 2 years if we're going to stay on track. To revert to business as usual and to have squandered this sort of precious opportunity that we've all here built together to use our collective strength to elevate the most vulnerable among us would really be a lost opportunity. The time to act is certainly now, but I'm confident that the global community, and in particular the countries, are laying the groundwork to accelerate progress in the future. So here again are just a few top-line statistics, which I think you can see on the sides, although unfortunately not here in the front. We have 5 additional countries in 2013, 3 additional countries in 2014, bringing our total number of commitment-making countries to 32. 1/2 of all FP2020 commitment countries have formal, detailed plans to guide national family planning strategies. 12 or a dozen of the FP2020 commitment countries hosted conferences on family planning in 2013 alone, including countries that had never done so before. And all 9 of the Ouagadougou Partnership countries have costed implementation plans. So for West Africa, which is the region of the world before the Ouagadougou Partnership and before FP2020 that was the farthest behind in terms of providing access to modern family planning, we see this as deeply encouraging that the commitment of partners and of governments has made such strong progress and built such a great foundation for future gains. These achievements are certainly due to the political will at the highest levels of governments, but the commitment of many partners as well is also essential, from civil society to the private sector, and we should not go forward without acknowledging that it's that core partnership that's really the foundation of the progress that we seek to make. Given that I just cited statistics showing the important gains in West Africa, I think it's also appropriate that we take a moment to acknowledge the Ebola crisis that has struck that region and the need of all of us as a community to both support those life-saving interventions, but also to come together to support the ongoing programs to reach women and girls and then to help rebuild those health systems so that we can ensure access to the range of health services, including family planning, in the wake of that crisis. So with that, we wanted to flag the progress of a few of our countries, and when we put this PowerPoint together, it was in the days immediately preceding the the change of government in Burkina Faso. So we had this slide and we thought about pulling it, but thought we would also just keep it up because we had built it as an opportunity to demonstrate what political will at the highest levels can mean. That political will is still important, but through this process, what we've seen in the weeks since this change of leadership in Burkina Faso, that it's really the national will that has taken over and maintained the family planning, the progress on family planning through Burkina Faso. So the slide demonstrates, sort of a dual-edged sword there, but really is a key opportunity to demonstrate how even when political leadership creates an opportunity, it's really up to that partnership at every level within the country to maintain and to build lasting support and programs. The next country that we wanted to highlight is the DRC, for Congo. In the 12 months since they made their commitment in Addis Ababa, they've already hosted a national conference. They've put allocated resources that are dedicated through a budget line to family planning. Their national movement is really beginning to take hold, and again, a range of partners are working with the government to move forward in the DRC. As you all know, it's a vast country with spaces that are very difficult to reach, but we're very encouraged by the government's high-level support for trying to bring access to many women and girls across the country. So in our report, we also put a spotlight on the many donors who support the family planning program and work in partnership with many governments and civil society organizations around the world. The Kaiser Family Foundation is here with us today, and they'll be presenting in greater detail on the donor spotlights. But I just wanted to take a moment here to acknowledge the commitment and support of the Bill and Melinda Gates Foundation. They invested $133 million in family planning in 2013, and they are on track to provide close to $150 million in support for 2014. The foundation's annual budget is projected to be close to $140 million per year for 2015 through 2020. They recently completed a new family planning strategy in support of the global FP2020 goals, and their long-term vision of accelerating universal access to modern contraceptives is also going to be focusing on 9 countries where they're hoping to accelerate progress, and those include India, Nigeria, Indonesia, Pakistan, Ethiopia, and DR Congo, as well as 2 of the Ouagadougou partnership countries, Senegal and Niger. Another one of our donors that we're so proud to be collaborating with is the Bloomberg Philanthropies. They are supporting us in establishing what we're calling our rapid response mechanism. This was launched earlier this year, I believe in July, and since then we've just had really an overwhelming response. Well, I wouldn't say overwhelming, but really exciting response. We've had applications from over 50 different individuals or organizations representing over 20 countries. We have had over, I think, 400 validation checks where organizations go onto the website and see if they meet the criteria for submitting an application. The rapid response mechanism was designed to try and get to unmet, unforeseen needs in a rapid way that really can help accelerate progress. So we're very excited that we've had such a strong response from the outset, and we've been able to fund 4 of those programs, and we'll be talking about those in greater detail later on. Civil society organizations, again, are the heart of the FP2020 partnership and are so essential to the work that's being done in every country. They're key players in advocacy and service provision and provide an invaluable voice in holding governments to account, but also really working with governments to meet the goals that governments set for themselves in wanting to meet the needs of their populations. So here we're going to just offer a special highlight on Indonesia because there, through the work of advanced family planning, we saw a really innovative program that specifically reached out to mayors in a number of provinces to really explain and elaborate what the benefits of family planning are and how those investments can really reap great rewards for broader development objectives at the local level. So through AFP's efforts, they were able to work with 5 mayors to raise their budget allocations for family planning. And in Bandung district, they raised their funding by 20%. And in Pontianak district, they raised it by 80%. So we're really seeing that very specific local level interaction between CSOs and government can have an immediate and really important impact on the kinds of services that are provided. In this upcoming year is an opportunity to continue advocacy. In Indonesia, we have a new president who is very interested in the reproductive health goals, and he's working with the UN and with others to really build Indonesia's program. And Indonesia will be hosting the International Family Planning Conference. I believe it will be in Jakarta. It will be in November of 2015, so we all look forward to that. We also wanted to highlight the work in Niger of the Hewlett Foundation, who's using commercial marketing techniques to raise awareness and create demand for family planning. The project is implemented by Hope Consulting and will generate a sophisticated marketing segmentation program for women based on their behaviors and preferences about family planning. The insights from the segmentation study will be incorporated into the Ministry of Health's National Family Planning Communications Strategy. Hope Consulting is also collaborating with a local social marketing organization's marketing plans. So through those two little spotlights, you can see a bit of the range of work that's being reached out. And finally, we wanted to flag the work in Kenya of DSW, who's bringing information about reproductive health and rights to young adolescents aged 10 to 14. Young adolescents are especially at high risk for illness and death from pregnancy-related complications, HIV infection, and other STIs. And I believe it was UNFPA's State of World Population Report for 2013 that signaled that 2 million girls aged 10 to 14 give birth every year in that cohort. So I think it's important that we look specifically at that young cohort, although it's not often the group that comes to mind when we talk about adolescents and youth. With 2 million girls giving birth every year, I think that we really need to look in a very clear-eyed way at the needs of that cohort and how we can reach them. Unintended pregnancy, as you know, is often the main reason for girls in that age group to leave school. And this Young Adolescents Project is a 3-year partnership with Bayer Health to bring reproductive health education to boys and girls at 9 primary schools in Kilifi County, which is a coastal region of Kenya. So again, these are just a few examples of the ways that civil society and public-private partnerships are advancing progress at the country level. So with that, I'd like to introduce the next two presenters. They are Jen Cates, who's the Vice President and Director of Global Health and HIV/AIDS Policy at Kaiser Family Foundation. And Jen will be giving a presentation on donor government assistance for family planning. And then she'll be followed by Emily Sonneveld, who you heard from a little bit earlier during our Q&A. Emily's the Director of the Track 20 project at the Futures Institute. And Emily will be presenting on our core indicators and key findings.
Thanks, Beth, and thanks very much to FP2020 for allowing us the opportunity to be part of this event and to present these data and really to contribute to the ongoing work of FP2020. I'm going to talk about funding, specifically funding from donor governments. Obviously, funding is a critical part of this story. It's not the only part, and it's not just the amount of money. How the money is used, where it's used is as critical as the amount. But what I'm going to focus on is the amount of funding provided by donor governments in 2013, and hopefully give you a sense of where that is going. And I want to thank as well, as I'll mention coming up, the governments that we were able to work with directly to collect data and validate that data. It took a lot of their time, so we really appreciate it. Very briefly, a little bit about the Kaiser Family Foundation. I won't read everything here, but the main thing I want to convey is that we are a research organization. We do policy research and analysis. So our goal in this work was to provide data that could be trusted and used by FP2020 or others to understand the funding trajectory for family planning activities. Next, please. So just to give some overview here, looking at all of the financial resources that are available from every sector, and Beth spoke about those sectors that are needed to fulfill family planning needs, donor governments provide a significant share of that global funding, and probably will for the foreseeable future. We initiated this project to look at donor government funding last year, as the FP2020 partnership had just been announced, to really provide that information on the donor side, and to adapt a methodology that we have been doing in HIV for more than a decade and apply it to the family planning context. So the data that we began to collect were first released in 2012, and that was, in a sense, a baseline. Where were we at the time when FP 2020 came together? This year's report is 2013. Was the most recent data available. 2014 data will soon be available. But it was really to give us a sense what happened in that ensuing year. Next, please. So briefly on the methodology, we looked at data for 2013. We looked at disbursements, so resources provided. We included in our analysis the members of the OECD DAC that reported ODA in 2013. And I want to just emphasize that there actually were more members of the OECD DAC in 2013. 3 additional governments joined, but had not yet reported data. So we hope to capture them next year. In addition to being able to access some data from OECD, what we wanted to do, and this is what we've done for a long time in HIV, is go directly to donor governments, because we know that the OECD DAC database doesn't necessarily capture all the information and doesn't code it necessarily in a way that might be it wasn't designed as a family planning funding tracking mechanism, for example. So what we did is we went to 10 donors that provide the majority of donor funding for family planning directly. We worked with them to analyze their data and make it apples to apples, comparative across donor governments. And for bilateral funding to attribute to a donor, whether it was the U.S. or Australia or the U.K., it had to be money that government designated for family planning, either through a bilateral relationship with another country or an earmarked amount of money that government provided for family planning, such as to UNFPA's Global Program on Reproductive Health Commodity Security. So if a government made a specific commitment and earmarked funds and provided those funds to family planning, they were counted by that government. And we validated all the data with the governments we worked with. On multilateral funding, this is an area we would love to expand. It's hard to count all of the multilateral funding that is available for family planning. For example, UNFPA, which is the key multilateral institution, we are able to understand their core contributions that donors make, but we don't have a way to break those down to understand which part is for family planning and larger reproductive health efforts. World Bank, we are not able to disaggregate funding from the World Bank into family planning. And those are sort of wish lists for the future, because I think we all need that information. Now going on to the findings. So looking at bilateral assistance, as you heard from Beth, in 2013, $1.3 billion for family planning was dispersed by donor governments, and that's an increase, a 19% increase over 2012. Whether that is directly attributed to FP 2020, it's definitely correlated with the announcements and the commitments and the increase in attention. And donor governments did provide more funding in 2013. 7 donors, Canada, Denmark, the Netherlands, Norway, Sweden, the U.S., and the U.K. increased their funding. And that was after taking into account exchange rate fluctuations, which are important. 1, Australia, was essentially flat. 2 governments, France and Germany, decreased the amount provided in 2013. Next. Most of the increase that was in 2013 was driven both by the U.S. and the U.K. as well as the Netherlands. The U.S. is the largest bilateral donor to family planning efforts, as we heard earlier, accounting for almost half of all of the funding. The U.K. is the second largest, followed by the Netherlands, Sweden, and Canada, to give you a sense of who is prioritizing family planning within their budgeting for global health. Next. And here you can actually see the breakdown. This is in the report, so for anyone who wants to look more specifically, you can see the amounts, the percentages, and learn more about the methodology. Next. So looking at multilateral assistance, with the limitation here being that we were able to just look at core contributions to UNFPA, and we're not able to disaggregate those into family planning specific activities. You can see that in 2013, $454 million was provided by donor governments to UNFPA, and that too was an increase. Among the donors we looked at and collected data from directly, Norway provided the largest core contribution. Sweden was next, followed by the Netherlands, Denmark, the UK, and the US. And I want to also note that Finland, which was not one of the governments we directly worked with to get data, although we'd love to expand the number that we work with directly, was if you included Finland in this list, was the 4th largest contributor of core contributions to UNFPA. The next slide should just have the visual there for you as well, so you can see who those players were who were contributing funding to UNFPA. Next. So just to sum up these data, among the donors profiled, we also looked to see which donors had specifically made commitments at the London Summit. This is important to look at. Of course, not all of the donors that we profiled did make specific commitments, but the U.S., as an example, is the largest funder of family planning. Of those that did make commitments, and I list them here, all 8 have made progress towards fulfilling those commitments. So we actually looked at what their commitments were, what they said they would do with their funding, and how are they moving in that direction. And all of that details in our report as well. Of course, the future increases are a bit uncertain. The largest donor, as I mentioned, is the United States. And for those who are following our current budget environment, it is not a very healthy one right now. So we don't know what the future will hold there. But these are, things we will continue to track next year. And I think for this year, the story is that there is an increase in funding. And since the summit. So I hope this is helpful to the conversation, and I look forward to hearing more. Thank you.
Okay, thank you. So as Beth said, I'm going to give a very brief introduction into some of the data and analysis that's included in the FP 2020 annual report. And hopefully with this information, will encourage more of you to download it and look at the additional information that's available. So before we get started, next slide, I think it's important just to give some very brief foundational information about where our data comes from and the process that we use to produce our estimates. So we start with very common data sources, such as the VHS and the mix. We add in some newly created data collection mechanisms, such as PMA 2020. We've also tried to find new roles for underutilized country-produced data, such as service statistics, and are working on developing and furthering modeling estimation possibilities that bring all of those data sources together in a way that we can leverage them differently. And the process used to do that differs by country. In countries that are part of the original cohort of pledgers for FP 2020, we're working directly with governments to institute a process that the government leads that includes an annual review of data, the application of these methodologies, and the production of the numbers, and then that information will be directly reported to FP 2020 and feed into the report that you'll be looking at. And all of that is done, next slide, with a really important focus on a couple tenets. So we want to make sure that what we're doing is building on the efforts of all of you in the global family planning community. So we want to make sure that we're furthering partnership and comparability with our estimates. We already had a question earlier about the impact estimates. And we also want to make sure that whenever possible, we increase our frequency of data availability and really try to move towards annual estimates. So this isn't only important for FP 2020. Of course, it is important for FP 2020 because in an 8-year initiative, waiting multiple years to have new data would create a very difficult circumstance for us to know if we're on track or not. But perhaps more importantly, it's also countries need the information more frequently so they can monitor their own progress towards their own family planning strategies and policies within their countries. So whenever possible, we're trying to develop new methodologies and techniques that allow us to increase that frequency. Next slide. So Beth mentioned that in 2013, we estimate an additional 8.4 million users of modern contraception. So what this slide does is it shows you where they're coming from. It's distributing those additional users by region. So when I look at this slide, the first thing I see is that a very large percentage of those additional users, it's actually about 49%, is coming from the South Asia region. You can see that at the bottom of the slide. And this isn't really surprising, considering we know that some very large countries, such as India, fall into this category. But one way to think about it, and that helps me contextualize, is to think, if we add up all the women of reproductive age in the 69 FP 2020 countries, about 52% of them live in South Asia. So their contribution of that 49% is actually representative of slow-growing contraceptive use in many of those countries and stagnation in others. And if we actually compare that to the Eastern and Southern Africa region, which only has about 10% of the women of reproductive age amongst all the FP 2020 countries, they're contributing about 22% of the additional users. And that's actually really reflective of a couple countries who have very fast-growing programs, such as Ethiopia and Rwanda and others, that are really driving them to contribute that disproportionate amount. Next slide. So the actual level of contraceptive use varies greatly across the 69 countries. We have very low, very high, and everything in between. But one way that we try to actually understand as a whole how we're moving forward is to look at the annual rates of change in the 69 countries. So what this slide is doing is it's actually taking all of the FP2020 countries, minus 2, we don't have data for Solomon Islands and Western Sahara, which are pointed out there, and categorizing them into different categories of rates of growth, and those are listed across the bottom. So on the left part of the slide, we have countries that either have negative or very slow growth, and on the right part of the slide, we have countries that have very high growth. And the two lines, the light line represents what we estimate in 2012, and then the darker line is what we estimate in 2013. So we can see that there's little movement, although there is some movement, some good, some bad. But in general, this graphic for us is really setting up a possibility to do annual monitoring that we hope each year we notice a general shift towards the right. So more countries join those 5 countries in the, that are growing at greater than 2.5 points per year, or at least the second to highest category that growing more than 2 points per year. And indeed, that's about the rate of growth that we would need in order to be able to meet the 120 million. And to put that in context, that 120 million target is really based on the levels of unmet need within different countries. So as countries accelerate their ability to meet unmet need, their growth rates will increase. And indeed, we need that to happen if we want to actually achieve where we want to be in a few years. Next slide. So in addition to looking at some of the main indicators, and this is a core indicator, this is method mix, which all of the data is in tables, massive amounts of tables at the back of the report. We also wanted to highlight some analysis that we think helps better understand how the information can actually be useful. So what this graphic does is divides countries into 4 categories. In the first category, these are countries where there are no modern methods that constitute 20% or more of the method mix. And most likely this is due to high traditional use. The next category is where only one method, one modern method, constitutes 20% or more of the method mix, and then 2 methods, and then 3 methods. So this is for us to better understand how diverse a method mix is. Now, of course, it's important to say that there is no ideal method mix, there is no perfect method mix, and so what we hope this graphic does is allows country to see whether or not their method mix is being concentrated in one area, or whether or not it's actually diverse, and if it's not, for them to ask an actual question of why is that diversity not there. If it's being driven by client preference, okay, but if it's being driven by barriers or other lack of access to care within the community, that they would need to ask additional questions. So method mix would be the trigger point. So if you notice a lack of diversity, maybe ask that question as to why that exists. So this slide actually only shows pledging countries because we couldn't fit all 69 countries on the slides. But in the actual report, you can see how the totality of countries are distributed across those different columns. Next slide. So this shows the method mix of countries that fall into each of those categories. So you can get an example of what the method mix actually looks like. So the first pie chart is for the DRC, and this is a country where there are 0 modern methods that contribute 20% or more of the method mix. And indeed, you can see that's because the vast majority of use is of traditional methods. And if you move over to the side, you have India, which is an example of countries where just one modern method contributes 20% or more. And you can see that that's because of a large share of use of female sterilization. And then the bottom 2 illustrate examples from Burkina and Mozambique, which are when 2 or 3 methods contribute 20% or more. So there's additional analysis in the report which actually looks at method mix from the other direction, from what happens when one method completely saturates the method mix, or what we would call method skew. So we have categories where one method takes between 40 and 60% of the mix, and also where one method takes 60% or more of the mix. And you can see that India would fall into that category here of method skew. Okay. So the next 2 slides are going to show some disaggregation of the core data. So a key bit of guiding advice or requests that we get from various working groups within FP 2020 is that disaggregation of the core indicators is really important to make sure that any progress that we see is happening equally amongst different segments of the population. So this first graphic, and I have Suzanne here nodding at me, so I know that that's a good thing from the Rights and Empowerment Working Group. So this actually distributes countries into 4 categories, looking at what contribution the poorest quintile has to overall contraceptive use. So over on the left side, we have countries where the poorest quintile contributes less than 5% of total contraceptive use. And then moving over, we have between 5 and 10, between 10 and 15, and between 15 and 20. So in a perfectly equitable situation, the poorest quintile would contribute about 20%, right, equal to the size of their within the population. So the good news is that we actually have quite a nice list of countries that already have equitable use of family planning. And what I find particularly interesting about this slide is that those countries represent low prevalence, high prevalence, and medium prevalence. And they also represent some very fast-growing countries. So you have Rwanda, who's growing fast and is growing equitably. So we don't actually have to wait to become a high-prevalence country before we can have equitable use of family planning, and that there's lessons learned within those countries for how we should do that. So in addition to that, the number of countries that fall to that 15 to 20%, we also have quite a few countries that are almost there, that are sort of perched towards falling into that higher category. So a lot of promise, but we would hope when moving forward that we'd actually see them move more and more again to the right of that slide. Next slide. So the last one that we want to look at is related to adolescence. And I know there was some mention of adolescence from Babatunde earlier today and the importance that they play in different countries. So this is actually looking at levels of unmet need, and it's comparing married adolescents, age 15 to 19, with the average of all married women of reproductive age, 15 to 49, to understand whether or not levels of unmet need is higher amongst adolescents compared to the average of women of reproductive age, or if it's lower. So in the left side of the slide, these are countries where the unmet need is lower. So married adolescents, have less unmet need than the total average unmet need amongst women of reproductive age. And then in the right column are countries where the married adolescents actually have elevated unmet need and would likely need to have more programs directly targeted towards reaching adolescents and making sure that they're able to fulfill their fertility desires. Next slide. So just to sort of sum up not only what you've seen today, but what's in the report, and to sort of second to what Beth had said in the introduction, is that we certainly see progress, and I hope that sort of came through in some of the charts, specifically in the charts related to additional users, but that growth is really going to need to accelerate if we're going to be able to meet the 120 million. And next year, we certainly hope that there's more people in the higher growth rate category when we replot that graph. But as we do that, and as we look at the numbers and make sure that we're moving forward, we want to make sure that we meet that challenge of making sure that progress actually moves forward in an equitable fashion, and that programs are being offered that have equal access, quality, and choice for all of the women, regardless of where they live and how old they are. So, thank you.
Thank you, Jen, and thank you, Emily, for those very helpful presentations that really dive into the substance of the report and give a deeper view of both the donor contributions and what that financial piece looks like, and the really rich data that we're able to now present to all of you, since we had our baseline indicators last year, and this year, we have for the first time this information of how we're moving toward that goal of 120 million. So within that, I think we all heard Emily really focusing a lot again on method mix and saying that there's no one right method mix for any particular situation. It's the range of options that are so important. And within that, we all know that injectable contraceptives can be one of the favored choices for women. They provide a lot of privacy. They can be done in your own home, or so that nobody has to understand or know what it is that you're using, so you have a lot more autonomy and agency. And again, I think it bears repeating that we really are focused on respecting and promoting the rights of women and girls. We see the human rights-based approach to family planning as being essential to our efforts to reach that goal of 100 million additional users. So our next presenters are going to be talking about both those 2 points. The first is Rachel Riccio from Pfizer, who will share with us some really great information about that's occurring with regard to access to injectable contraceptives. And then we'll also be hearing from Suzanne Ehlers, who is the President and CEO of Population Action International, PAI. And Suzanne is also the co-lead of FP2020's Rights and Empowerment Working Group. So with that, Rachel and Suzanne, please join us.
Good morning, morning, everyone. I wanted to start off by thanking Beth and FP 2020 colleagues for inviting me to represent Pfizer here today. I'm really excited to have the opportunity to attend this meeting and share details of the collaboration that was announced just a few short weeks ago, through which Pfizer, the Bill and Melinda Gates Foundation, and the Children's Investment Fund Foundation are working together to expand access to Pfizer's injectable contraceptive, Cianopras, for women most in need in the 69 Family Planning 2020 focus countries. Through this collaboration of organizations from both the public and private sectors, Cianopras will be sold for a maximum of $1 per dose to qualified purchasers, which may help to enable the poorest women in these countries to have access to the contraceptive at reduced or no cost. The story of Cianopras begins with one of Pfizer's heritage medicines. Through an approach built on collaboration and ingenuity, we applied a technology that eliminates the requirement to prepare a separate needle and a syringe and combined it with a lower dose and volume of our heritage injectable contraceptive, Depo-Provera. Cianopras is the result of this effort. For many women, long-acting injectable contraception is appealing. It's discreet. No daily pill regimen is required. For some women living in remote areas, it can alleviate the deterrent of having to frequently travel long distances to get to a clinic. Based on our deep heritage and experience in the contraceptive space, and with the help from important organizations like those that join us here today, Pfizer understood this distinct need for an additional contraceptive option in Africa, Asia, Latin America, and certain parts of Europe. The training required to administer Cianopras is basic and straightforward, facilitating administration by health workers to women at home and in other convenient settings. This agreement helps to establish a sustainable model. Through financing from partners like the Bill and Melinda Gates Foundation and the Children's Investment Fund Foundation, and in-country distribution through DFID, PATH, UNFPA, USAID, and many, many others, expanded access to an important family planning option is being made possible. Thank you again for the time. We look forward to working with colleagues in the global family planning space to help contribute to the Family Planning 2020 effort by providing more women around the world with contraceptive access and options. Thank you.
Good morning to all my colleagues here in Washington, and I guess good afternoon to those of you who are, I think, joining us, tuning in from different parts of the world. Thank you so much for being with us today. At the last global consultation, if you were with us then, you'll remember that my job in that session was to introduce the Rights and Empowerment Working Group, to talk a bit about our work plan, to talk about the ways in which we hope to provide a foundational base around quality rights and empowerment to all of the FP 2020 initiative. So I'm particularly pleased to be with you this morning to share with you an example of a real concrete success, concrete progress that we've made as a working group in further strengthening the underpinning of rights and empowerment to the FP 2020 initiative. And I will be introducing and launching a foundational document called the Statement of Principles that the FP 2020 family and all of you as external stakeholders, I hope, will use from this point forward. Next slide, please. So we heard from Dr. Osha Tumain this morning, and this is a great example of the centrality that he sees and the agency of UNFPA sees to the human rights-based approach to family planning. I also want to be sure that I thank my co-lead at the Rights and Empowerment Working Group, Siva Tanantaran. She's of the Arrow organization based in Kuala Lumpur, Malaysia. It's some odd hour there right now, so I doubt she's tuning in, although congratulations to her if she is. I also want to acknowledge the really important work of our working group members around the world, many of them from your organizations, who put in a lot of volunteer time, effort, energy, and really critical thinking to advance this work. Of course, to the Family Planning 2020 Secretariat and the leadership of Beth, And then the reference group, some of whom we've seen this morning, and certainly Babatunde represents the co-chairs of the reference group, he and Chris Elias of the Gates Foundation. The Rights and Empowerment Working Group joined the reference group meeting in early November in London this year, and saw that our working group really constituted the theme of that reference group meeting, the ways in which rights and empowerment and equality and all of the principles that this document embodies is really what will be key to the success of FP 2020 by the year 2020. We're intended to provide technical guidance and support to the whole of FP 2020 in a rights-based frame for the initiative. And I think importantly, as an advocate and as a CEO of PAI, I will say that it's more important that we have not just good rhetoric and good language, but that we're helping translate that rhetoric into reality, into country programming, into policies, and that where we see opportunities and country commitments, all 32 wonderful of those commitments, that we're helping figure out how to implement and execute those commitments into action. And I think this quote also exemplifies some of the passion and enthusiasm that I saw among the reference group members, essentially the board of directors for FP 2020 for this agenda, a much deeper sense of connection and commitment to the rights agenda than I maybe had anticipated going in, and it was really quite encouraging. So I want to make sure that this audience knows that. The next slide, please. So the Rights and Empowerment Principles, we convened first as a working group in August of 2013, and then again earlier this year in April 2014 in this room right here. And as a working group, it's been key to us, and I think you've heard it throughout the morning, but I'm going to go ahead and say it again, that we are, of course, very motivated by the goal of FP 2020 and the 120 million new users. We are more motivated, however, by the narrative and the story of the women and girls that constitute those numbers. And so for us, we see it as our daily job to constantly put that story and those faces forward and know that if we don't reach numerical goals, as long as we have advanced, protected, promoted, and fulfilled the full human rights of women and girls and boys and men around the world, that we are moving toward that shared agenda. It's a really key piece of our working group that I want to make sure I've articulated with you all here today, that we are motivated by the goals, but more importantly, inspired by the real lives and the faces of women and girls around the world. Now, the work that we've done with the Statement of Principles, I want to also acknowledge the incredible work of so many of you in the room and not in the room around existing human rights resources, including the conceptual framework that Pam Barnes, my colleague at Engender Health, mentioned earlier, undertaken by Engender Health and Futures Group with the support of the Bill and Melinda Gates Foundation. Also, incredible foundational work on human rights done by the World Health Organization, by UNFPA, and by more partners that I'll have time to mention this morning, and to make sure that the group understands that the working group's responsibility was to really aggregate those incredible resources and put them in a form that could have FP 2020's name on it and could be used at the national level with focal points from UNFPA and USAID, with ministers of health and other key ministries in country, so that we were putting forward a document that talked about, you've signed up for FP 2020, you've made a commitment, you're part of the family, this is what it means, this is how these principles and human rights need to be manifest in those commitments. And we thought it was key to sort of take the best-in-class work that was out there and put it into sort of a singular document, if you will, which is what we're introducing this morning. We also wanted to make it particularly relevant for FP 2020, and so you'll see that we've put under each of the principles illustrative examples, policy and program, which we hope relates directly to the country engagement working group. We've put examples that relate to measurement, which of course is directly related to the innovative work I think that we're doing with Emily and her colleagues in the performance monitoring and accountability working group. And then lastly, we're making sure that these principles are understood and how they might manifest in a markets example, and in that instance working collaboratively with the market dynamics working group and a really incredibly creative bunch of individuals who are helping us see the way voice and equity and participation might play out in a markets dynamic context. Next slide, please. So this is a screenshot of our Statement of Principles, which I believe is being made available to all of you today, and it's also available now on the FP 2020 website. I want to acknowledge my colleague from PAI, Kim Ochiltree, who helped support the working group and FP 2020 and really led a highly collaborative and consultative process, which is resulting in this document here today. We've listed the key principles down along the right side of the slide, and then as I've described, within the Statement of Principles, each of those principles, within the statement, women. Each of those principles is given an example of how it manifests in different contexts. Again, made to be relevant for the costed implementation plan process, the CIP that's happening in country. We, of course, it's our goal that all of these principles would be obvious in all of the CIPs all over the world in all 69 countries tomorrow. But we know that that's not the reality. And so we're really trying to work in partnership and hand in glove at the national level with highlighting best practice where it exists, in connecting country actors where they can learn from each other on progress made, and advancing the needle in any one of these areas we see as a real step forward in family planning programming. So I wanted to just give a couple of examples of how these principles look in practice, and I think I've got 3 of them here. If you go to the next slide, please. This is the first one where we've taken agency and autonomy, and we've provided, again, an illustrative example of how agency and autonomy might look within the measurement context. With Emily up here earlier, who does such an artful job of describing this from a data and statistics perspective, I won't try to replicate her unparalleled work. She has been a really key partner to our community in trying to sort of talk about the importance of disaggregation of data and how we're trying to tell the story of women's use of contraception from a whole variety of different perspectives. And we, of course, were part and parcel of the effort to provide baseline measurement indicators for FP 2020, but ongoing work is that we're working on a learning agenda. So we're looking always at new ways to collect new data that tells these stories and also interpret existing data that perhaps we've been collecting for decades but have never really sliced it and diced it in a way that might better inform what voice and equity and participation looks like at the national level. So that's one example that I've put forward that, again, because of its measurement focused, directly relates to the performance monitoring and accountability working group. This next one, as we pulled out, is informed choice, and we've given a policy and programming example. So again, an effort to work closely with the country engagement working group and their incredible group of actors who at the national level, largely through the leadership of the Futures Group, is developing costed implementation plans. So the toolkits that are being used in the CIP processes, either at the planning stage or the development stage, more importantly, at the execution and implementation phase, are there ways, are there opportunities, are there gaps where the rights and principles documents can be included in those CIPs? And this would be an example of how we might see informed choice manifest in such a context. The next slide, please. And lastly, we took the principle of transparency and accountability, and we gave a markets example. I have been particularly inspired by some of the markets work and collaboration that we've done with John Skipiak and some of his colleagues as part of that working group. And so we wanted to be sure that we put up a really strong example of the ways in which that private sector and the markets example might pull forward one of these key principles and make it a key piece of their work. Another innovative collaboration that we've done with the Market Dynamics Working Group is a first-of-its-kind contraceptive manufacturer survey, where we surveyed a number of contraceptive manufacturers and asked them the ways in which voice and participation of end users might influence both product development and market planning. It's a very brief survey at this stage, tells some really interesting stuff, but more importantly, I think sets the stage for further collaboration and inquiry, and quite honestly, an opportunity that I think wouldn't have been taken advantage of without the leadership and the collaboration that FP 2020 inspires between the different working groups. So not only is this a statement of principles example, but wanted to be sure I highlighted some other ways that we're working with our markets colleagues here. The next slide. I wanted to be sure that we also had a powerful quote from a service provider, someone on the front lines of this work in the country of Tanzania. I think the quote stands for itself. I won't repeat it here, but we started with a co-chair quote from Mr. Babatunde Oshitimane, and I wanted to be sure that we also remembered the centrality that service providers and women in the field really see family planning to their efforts around economic growth and opportunity, to the health and education of themselves and their families. Okay. Is there another slide after this? I'm not sure where. No, that's the end, but I have a couple of just sort of closing remarks. I wanted to be sure that as the co-lead of the Rights and Empowerment Working Group that I didn't miss the opportunity to acknowledge the tragedy that we witnessed in India a couple of weeks ago and to acknowledge that happened shortly after our very inspiring conversation with the reference group and the start of a partnership with the Secretariat and the reference group and what FP 2020's roles and responsibilities might be in the face of such a horrible tragedy. So I want to be sure that I acknowledge that as the co-lead and put it out there that for me just drives home the absolute urgency and critical nature of this agenda. And I realize that the story is still being told and understood, but that is it's a key piece of where we were constituted as a working group in the first place. And again, one of the ways in which we see the success of FP 2020 really being kind of on the backs of human rights frontline defenders. I also highlighted earlier the indicators work and the learning agenda, and just again give a shout out to Emily and the work of the PMA working group. Some really interesting stuff going on there, and so I encourage you to take a deeper look at the progress report and some of the ways in which they're telling new stories out of the data. The market surveys work, encourage you to look at on the FP 2020 website, and then of course invite your partnership, particularly when it comes to the work we're pursuing at the national level around cost and implementation plans, which will be, sort of essentially where the rubber hits the road in the coming years on how these, not just political champions, but sort of national will can really get behind the expansion of family planning and contraceptive service provision at the national level. And we stand at the ready as the Rights and Empowerment Working Group to pursue partnerships with all of you in that effort. So thank you.
Thank you, Suzanne. As always, it's inspiring to hear you speak and to really benefit from the way that you bring all of these issues to a sort of holistic look at what rights and empowerment really mean and how they penetrate across the various efforts that we as FP 2020 represent. And I think that's what makes FP 2020 now an exciting moment, it's an exciting moment now to be part of FP 2020, because the first few years really were about building this partnership, hearing from all of you what would be most beneficial, coming together as a group to really develop these working groups, to have a reference group that met regularly and provided the kind of leadership and vision that we needed to move this forward. We're really now at this point where we can see the sort of cross-fertilization among the different groups, and for rights and empowerment more than any others, it's really about bringing concepts to the work that's being done and creating new conversations. And so thank you for your leadership with that and with SIVA. It is an exciting time, and we're very gratified that we have this opportunity to create these kinds of conversations and discussions. And thank you also to Rachel and to Pfizer for taking the time to be with us today to make that exciting announcement. So with that, we're at the point now of having a few minutes left for Q&A. I'm glad we snuck one in earlier because we're sort of down to about 5 minutes left. So with that, I'd like to invite our three government representatives again, Dr. Napo-Koura, Professor Mba, and Dr. Ndayikunda, back up here to the chairs because I want to ask each of you a question if I can, and just to maybe get a quick response, maybe a minute each, to hear your thoughts. Because we've had well over 100 questions, and I want to share again our commitment to responding to those questions using our online platform, which we'll be doing over the weeks and months to come. Probably we'll put some of these questions together, sort of a basket of response, to make it easier to give you sort of broader responses. But one of the questions that we had that came in through Twitter was that we recognize that there can be no sustainable development and no real progress on expanding access to family planning without meaningfully involving young people. So I wanted to give each of you the opportunity to, again, take about a minute to let us know what you're doing in your countries to reach young people, what those challenges are, and how you're specifically going to be doing that. So, Dr. Ndayikunda, could you please take a minute and answer that question?
Thank you very much. In Burundi, we are aware that without trying to reach the young people, we will never be able to reach our goal with family planning. So we created centers where young people meet, centers which are accessible for all young people. whether they are young people who go to school or young people who didn't have the chance and the opportunity to go to school. So there we are talking to them about family planning, about sexuality, and that way they know how to avoid pregnancy. And based on this, we elaborate a curriculum which will be taught in primary and secondary schools to show young people how to avoid unwanted pregnancies and how you can choose when to have and how many children one would like to have. And this is what we are doing. Thank you so much.
Okay, thank you very much. In Cameroon, about 23% of the population is made of adolescents and youth. And these youth cut across a lot of ministries in specific programs that are in the ministries. For example, the Ministry of Higher Education has health facilities in the universities. Unfortunately, these health facilities were never talking of contraception. So the Ministry of Health is cutting across. We are moving contraception now to these centers which exist before, which were never talking about contraception. It also occurs in a community that they have what they call youth centers. They were never talking about contraception, so we're taking contraception to these areas. Besides that, we're going to do what we call the community reach out, and most of the non-scholarized adolescents are found in the community, so we're going to reach them with our new program that has to go to the community to look for adolescents. Thank you very much.
Thank you, Dr. Mbu. And now, Dr. Napo-Koura.
Merci beaucoup.
Thank you so much. In Togo, young people, as I said in my presentation, the young people are really our target, our particular target. Often they are marginalized. And so the Ministry for Health put in place a national service for young people and adolescents. And this national service takes care and puts into place a specific policy for young people. And within this policy, you have specific programs which are designed for young people, and they have been implemented. And these programs, for example, are about the fight against AIDS, against drugs, against unwanted pregnancy, and how to prepare young people to act responsibly. And in the sanitary structure in our whole country, we have now services adapted to young people where they can get family planning. Also in schools and universities, there are some doctor offices where the young people can go to get information. Thank you very much. Thank you so much, Doctor, and again, thank you so much to be here.
Once again, thanking our colleagues for joining us from Togo, Burundi, and Cameroon. So with that, we're right on time, but we did have one other question that I just wanted to quickly answer because I think it's an important issue. We wanted to make ourselves available to take on what sometimes seem to be some of the harder questions. Over the course of the last year, we've received actually several inquiries, and in the lead up to this stakeholder consultation, we had 2 questions about the relationship between progesterone-only contraception and HIV/AIDS risk. So we just wanted to take this opportunity to say that, we take our guidance from the expert WHO panel, which in 2012 determined, after carefully reviewing available observable studies, biological evidence, and other data, that the data on progesterone-only contraceptives and HIV risk are, at this point, inconclusive. There's insufficient evidence to recommend that women not only use injectables or to recommend other methods as posing less risk to HIV/AIDS acquisition. It's crucial for women to be provided with information on both the benefits and the risks associated with using different forms of contraception. Women who use family planning methods such as implants, injectables, or pills should be strongly encouraged to use a barrier method for additional protection to reduce the risks of acquiring sexually transmitted infections, including HIV/AIDS. If the ongoing ECHO trials determine that women using progesterone-only contraception have increased risks, we should look to authorities such as WHO and national ministries of health to take the lead on issuing any changes to public health guidance. And so we will be watching this closely, and we'll come back to you with additional information as we have it. So with that, I wanted to reassure you again that we will get to the additional questions using our online platform. And I wanted to just give you my sincere thanks for your participation today, for all of you in Washington who came to join us here at the UN Foundation, for everybody in New York at the UNFPA headquarters, and to the rest of our global partnership who've joined us online today. Thank you again for all of your collaboration and for being with us today. Goodbye.